so we have
Thank you.
now Adriana. Adriana, please take over for your talk, and then we open it for discussion at the end for all of you. Thank you.
Okay. Okay, hi everyone. Good afternoon. I'm Adriana Ruiz Centurion. I'm a general dentist from Paraguay, and I'm gonna talk about dentistry and oral health, the status in Paraguay. So, just a little bit of my country. The building that you see on the upper right, that's called the Palacio de los Lopez, is the government place where the also called Presidential Palace, where the president and all the government body goes. Is basically their office every day. Then you have another building that's called the Jesuit Guarani Missions. These are buildings that were built by the Spanish colonizers. They founded around 30 missions in between Argentina, Brazil, and Paraguay. The building is a Spanish Baroque architecture, and they use a lot of indigenous materials for it, and they will use that to teach their religious belief, like Christianity and the Spanish culture. The ladies that are with their vases and dancing, well, that's part of Paraguay's folklore, which is the people's knowledge. We have a day that is called the Paraguay Folklore Day, and these are the traditional dances that they do it on that day. That soccer team that you see over there is our national football team. We're very proud and fanatic about soccer, and we know it's a football. This one of the last good teams we had. They went to the '98 World Cup. They made it to the second round, the best 16, and then they were facing France. And with the French team, they tied up in the 90 minutes, the first 90 minutes in 0. And then this is a very painful memory to relive right now. Sorry. And then by the end of the game, with the goal that is it's called the golden gold, because once they do it, they just the game is over. So that's where we lost the game at that time. Okay, so some country demographics. The Republic of Paraguay is a Mediterranean country, bilingual. We speak Spanish and Guarani. Guarani is from the native language, and the Spanish we learn from the Spanish colonizers. It's located in the central area of South America, divided in 17 departments and 18 health regions. The population in 2015 was almost 7 million, and 1.8 of them was the indigenous population, the native, and the life expectancy was about 70 years. The health system in Paraguay is divided in public and private. We have centralized in the public, we have centralized administration and non-centralized. Part of the central administration is the Ministry of Health, the military health, police, and army health. The non-centralized administration is a clinical hospital, an institute of social welfare that would give medical insurance to most of the government employees. And And then we have the state administrations and the boroughs. In the private, you have the nonprofit, which are non-government organizations and credit unions. And then you have the for-profits with, we have prepaid medicine and private providers. So this is the building for the Ministry of Health, and also the, let me see. Yeah, the building for the Hospital Central, Central Hospital, that will provide the insurance for the government employees. And one example of a private hospital is Sanatorio Migón. The health statistics is the percentage of people without health insurance is about 70% in 2015. And this is due to mostly extreme poverty and the language. They mostly speak Guarani, and they have their own beliefs about health, and so they don't give it a lot of importance. The registered dentists to practice in 2018 were about 7,671. And so that makes for one dentist for every 902 people. The tendency for them is to practice in large cities and urban areas. And according to the Ministry of Health, they created a resolution in 2009 to eliminate fees for the charging services for medical for dental services. Okay. The oral health statistics. The most frequently reported oral disease is dental caries. In children 5 to 6 year old, the COD index, which is also the same as DMFT, was not, almost 4 and 5.57. And the caries element was 96%. The caries experience was 81%, and untreated caries was 80%. And for only 25% of them, they presented the COD as 0. And for ages 12 and 15, CPOD was 2.79 and 4.34. Some programs for oral health that were implemented. One of them was in 2009, the National Oral Health Policy for the Right to Smile. They developed some health promotion programs and prevention of oral diseases, and also healthcare and comprehensive rehabilitation. And here are some of the numbers. They increasingly got better, and they started in 2009 with 242 number of dental services, and by 2017 they had 427 increase the number. Another one was it's called Let's Save the First Molar. They use the PRAT strategy, which is the traumatic restoration procedures, or ITR, what we know. And they found that the mouth that were rehabilitated with the PRAC technique increased in 15%, and the second year was 24.68%. So they realized that they had significant results in children, and the PRAC strategy is actually very effective in urban and rural schools. Another one was Paraguay Sonríe, or Paraguay Smiles. That was for rehabilitation of patients with prosthetic needs. They had a central lab, 4 prosthodontic dentists, mobile clinics, and they did in national hospitals and different cities. They started in 2011 with 3,000 dentures or partial dentures. And by 2017, they had half the number, but they did the program for 7 years. And the program SMILE again does a program targeting patients with structural congenital malformations like cleft lip and palate. They started on 2009, and to May 2017, they had done 783 patients, and they've been treated with 132 surgeries. So there were 2 surveys done, one in 2008 and one repeated in 2017, and they found these kind of differences. There was a decrease in the prevalence of caries in the population from 80% to 63%. A decrease in the decrease was greater in the urban area. And the general population, there was a higher prevalence of caries found in females instead of males, 50 to 49%. There was also a decrease in the experience of caries in temporary teeth in the group of 5 to 6 years. It decreased from 81% to 67%. That was with the implementation of all these programs. And the insurance situation, from 59% in the group of 12 to 15 years, and the higher percentage of insured population was in the urban areas with 45%, and in relation to the rural with 28%. Sorry. The barriers for dental care are mostly the lack of access to health services because of transportation. That usually happens more in the rural areas where people just have to walk a lot just to get into the road, and then they have to wait for a bus or some kind of sometimes they do it with a group of people, and they go all together to the nearby hospital or public service. And there's also a problem with medical insurance, because most 50% of the people that were part of the survey did not have medical insurance. Only 40% will have it, and the rest will not know or did not answer. The difference that I encounter between US and Paraguay, in terms of public health, I would say that the military, veteran, and police and army are very well developed. But in Medicare and Medicaid here are very better funded. In public services are usually, unfortunately, tainted by corruption and budgeting mismanaging, and that will affect all these programs that in the beginning they have a very good idea what to do, and they have the budget originally, but then there's mismanaging, so all these programs suffer in the end. From private health insurances, it's more affordable here in the US comparing to Paraguay, in the sense of in Paraguay there are high premiums and there's low coverage, and that will be the premiums are not very comparable with the wages that people receive in their jobs. And in terms of private insurance only will cover basic dental services like the first appointment and maybe x-rays, and there's a high number of patients, and so the dentists are overworked basically when they work in private insurance plans. And again, the lack of transportation. in rural areas that will affect the services and the people that can arrive to get their service done. Dental education, the dental school is 5 years. These are the dental schools that are accredited right now for, it's called ANEAES, it's a national agency for the accreditation of higher education. It's comparable to CODA, and they follow the national model, which is the National University of Asunción. That's the university I graduated from. So the career in dentistry, according to the National University of Asunción model, there's an admission course that will last 1 year. They have a first, second, and third partial exams, and then there's one final general admission exam. The subjects are human anatomy, biology, chemistry, reading comprehension, and mathematics. And then the dental schools is 5 years long. So, oops, sorry. So in terms of my UCL experience, I did the first year in the pediatric dentistry ACT. What I gathered the most and was more helpful for me were the CDC clinics and pediatric dentistry lectures. I learned about diagnosis and prevention, full therapy, treatments. Minimally invasive restorative dentistry was very new to me, and is a concept that did not had in my previous training. And behavior management and guidance, I love those. They were very insightful, and I learned so many skills and tools to be able to communicate with children especially, and then with their families, and realize that it's really helpful and opens the communication and eases the treatment later. I use a peer rotation. I enjoy a lot the interaction with patients that come from underserved communities. It was interesting to hear their stories and what they go through every day, and to see them actually trying to bring their kids to have the oral services done. And the use of camera protocols is a great tool to understand the patients and how what they do at their house, and how their lifestyle will be of impact with the treatment that we want to give. And the orthodontic clinic and seminars, I enjoy craniofacial development and principles of interceptive orthodontic treatment. And in the IBGA or OR rotations, I learned from pediatric sedation principles and clinic protocols. It was really interesting to see the management in an IBGA clinic, and I participated in scheduled procedures for medical complex patients. That was really insightful too. So that's it. Thank you so much for this first year. I really enjoyed. Thank you so much to all the residents and faculty. It's been amazing.
Thank you so much, Adriana. Maybe you want to stop sharing so we can see the photo gallery of people. Are there any questions for Adriana?
Here.
So they love it. They said you did a good job. Are there any questions from the residents to Adriana?
Hey, Adriana. I just have a question. You were mentioning that you guys speak Spanish and Guarani. So the people that speak Guarani, do they also speak Spanish, or?
No. Well, there is a lot of in the rural areas there's still people that only will speak Guarani, and it's like the purest one, which is really difficult to understand. Then there's the people that will speak a little bit of Guarani and a little bit of Spanish. And like, for example, my dad was from the countryside, So he learned Guarani, but not the pure one, but he still speaks, right? So he knows a little bit of both. He knows Spanish really well. And then there's people like me that I mostly speak Spanish, like I can understand everything and speak right all. And then I I know a little bit of Guarani enough to mix it up with Spanish, basically.
Ah, like Spanglish, but
We,
Spang what?
yes, we call it Yopara, which is Yopara is actually in Guarani. So it's just a mixture. Like it helps you communicate better and like put emphasis, and it's sometimes really fun to use.
Awesome. I guess my question was, do most of the health providers or the dentists, do they mostly speak Spanish, or do you have a lot of the population that also speaks the Guarani or the mixture, or is that like one of the big issues for the people in the rural areas?
I would say most of the providers speak Spanish and maybe a little of Guarani. The thing is that most of dental schools and universities are in the capital, so where everybody speaks just Spanish or a little bit of Guarani. So when they go to the countryside, it's kind of an issue, yeah, with communication.
Okay, thank you.
Sure.
So as you can tell, it's a global epidemic of early childhood caries. No matter you are in the South America, South Pole of the world, or in the North Pole of the world, or in India, or in Iran, in Mexico, in Africa. I mean, it's a global epidemic, right? So
Yes.
it's so much needed. When you think about, say, totally preventable disease, that's 100% preventable. I mean, it's just a pity
Yes.
that we allow our communities and our children to go through life with this condition that is not, something that they need to go through if there was a little bit of awareness and effort at the beginning, the early years. So this whole idea of having the H1 policy around the world is such an important issue. As you know, the International Association of Pediatric Dentistry just promoted an ECC work team around the world to really promote this H1 visit throughout, and they have several symposiums that they've been doing and organizing, and there was going to be one in Taipei in Taiwan. I was invited September of this year. All that is gone, of course, like all the other meetings, but hopefully they're trying to come out with a consensus again for promoting and advocating for children's oral health around the world.